Hello, this is Mark Anthony with Edge on Regenerative Medicine Show. We have today a special guest. I have Dr. Nadine Weingarten. Love that beautiful name. You can find her at Dr. Nadine New at .com, drnadinenew.com, and that's Dr. DRNADINEW.com. We have a great topic today. This is an interesting topic, and I have never seen anybody really talk about this, so I'm really excited today. The topic's going to be on unifying the profession of chiropractic and integrate chiropractic in the medical world of hospital and urgent care clinics. This is a really important topic here, and I just want to say, Dr. Nadine, thank you so much for being here on the show.
Thank you. So let me clarify what you just said.
I love it. Let's clarify.
Okay.
That's how we know you're a doctor.
My name is Dr. Nadine Weingarten, newly married and duped.
Congratulations.
Just call me Dr. Nadine. By curse, I'm sorry, from New York. Now, to clarify what we were talking, what you integrate chiropractic into urgent care in the hospital, but the chiropractic drug. Because I don't want drugs, and neither should they. Drugs should be a second.
I agree.
Chiropractic should be primary, like all preventative medicine, checkups, yada yada. Then surgery. But innate intelligence is limited. Now, if you find from birth right before death, then you should be okay. But we have one: innate intelligence, medical maximum necessity improvement, MMI, medical maximum medical, aka your innate intelligence can't do any more than it. So we have optimal function. It's got a leg chopped off from being a World War II vet. And they're 65, 67, 75 years old, and osteoarthritis, and rheumatoid arthritis, and they have PTSD. And now they're in a wheelchair. Let's try to get them in a prosthetic with a walker, and there you go. And while we're at it, bring our PT to do actual exercise. And if they don't know what they're doing, then bring in a chiro to adjust every single joint that is infused or broken, and do physiotherapy with them. So I don't want to get PT. I work with many PTs. Last PT got PO'd because I did her PT. Anyway, let's not talk bad about blah, 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 blah. I'm tired of the BS of fighting between chiros, fighting between medical, fighting between PT, which they do are adjustment the manipulation. And the DOs, let's not even talk about them, they've already converted to guns. Most DOs, they don't know the difference between PD and DO because all they do is thank you. So that's the topic I wanted. Chiropractic, its own department within the healthcare medical model, which is fun. You can have your sprinkles on top of your Sunday. Why stop the sprinkles of chiropractic?
So how do we get them together? What are your thoughts? Do you see that happening soon or in a possibility?
Depends on the state, depends on the chiro, depends on where they came from. Are they first generation, second generation, third generation, third generation? Are they wanting to be a medical doctor but couldn't get in, so they went to the easiest thing they thought, which was chiro? Because they didn't want to do PA school, and they didn't want to do DPT school, and they didn't want to do dentistry, and they orthopedics. So what they do, chiropractic school is very interesting. That's almost any idiot in, but it doesn't let you successfully get through. And you can get through and still not know what the hell you're doing. It's amazing, chiropractic. Thank you for Irene Gold for review. Irene Gold, when she got her bid goes up to the heavens, she will still be talked about 100 years ago. Just like Steve Palmer, just like
Yes, exactly.
Ted Williams. She is my Mabel Palmer or whatever her name is. Wasn't it? I don't know. Anyway, she got me through. She got $1 million. I know she goes. She gave birth to 1 million chiropractors.
Wow. Can you see what, I mean, how can you see there to be an integration? Like, what do you think are the steps that we need to take?
I'll tell you what it is. Mr. and Mrs. patient comes in. Where? Where they were told to. Who has the most? Chiropractors or medical doctors? Who has the highest malpractice? Who doesn't?
Mm-hmm.
Who's alternative health care? Why is that? Because the dentistry is not alternative health care. That's back in I don't know when, the dentists all got together and did what? Came together, took their egos out of their asses, and became the standard now. Right?
Mm-hmm.
So is it the chiropractor's fault? Chiropractic physician's fault? Profession's fault? Or is it the medical model? Why do we have to fight? Are we all human? I can't tell them. Husband's in the back.
You're funny. You're hilarious, by the way. I love it.
For my birthday that's coming
You should.
up.
I think you got a calling in acting. I'm not joking. Like, it just gets a natural thing. I love
Well, I'm sorry. Jonathan Sanger, the director, says my life is pretty
it. Yo.
I just don't have a screenwriter.
Oh boy, I love it.
And you know where I know when I was looking at practice in Buffalo to buy, but Buffalo's really cold. And I was staying in a hotel in there, Buffalo, and there he was in breakfast, and there I was in breakfast, and there you go.
Boom.
So anywho, let's talk. I don't know what it's gonna take, because most people, if I say that to some other chiropractors that are up to the level of, oh my God, I hate MD. You know, I dated an MD. You know what you called yourself? A major dick. I call him a dealer.
That was a good. Well, hey, at least, hey, the truth will set you free, right?
If it doesn't, then God.
Yeah.
Because it's not me saying.
So let me ask you a question. I noticed that there are also a lot of doctors that I'm noticing, chiropractors, that are getting more into the regenerative medicine part. You know, so it's kind of, I feel like it's one step closer in. Would you say?
I would say that I don't do functional medicine because I'm not supposed to do medicine, but I do treat the body holistically, as in a whole. I don't say don't take your drugs. That's not my job. Don't tell me I'm a mechanic. Don't ask me how to do your surgery. I'm a mechanic. So, functional medicine is not a bad thing. It's a good thing. It's bringing us to the medical model. But what is the pure treatment of a chiropractor besides a listening ear? Chiro, by hand. So what does that mean? I'm going to stop treating people, and I'm only going to be saying to people, I'm not going to touch them. Are you an ortho that's trying to be an MD? Listen, my friend, I won't say her name. She's a chiropractor in Ohio. She does weird, cool stuff. I've been adjusted by her with SOT technique and all that stuff. And she's getting into regenerative medicine because she suffers from multiple chemical sensitivities and toxic mold, toxicity, and all that jazz. And she's smarter than me. And maybe more talented. But my mouth is bad and good. I know how to talk to people, whether they're a bump or a.
Where would you say most of the healing is? I understand we're talking about the hands. Do you think that a lot of it also is mechanically from up here? Maybe not, maybe healing of past trauma, stuff like that.
What's the three things that cause subluxation? What's that word? Subluxation. Subluxation, according to Life University, And D.D. Palmer Chiropractic in Iowa, where it was invented by D.D. Palmer, 5 and September 18th. Just happened because it's now, what's today's date? Just recently. So anyway, chiropractic and subluxation, if they call it an archaic term, I'm sorry, then they didn't go to life for sure. His subluxation, the philosophy, I was told by many chiropractors, some dead, some alive, some just died, some whatever. Okay, the dearly departed Dr. John D'Onofrio of Chiropractic Board Neurology and Irene Gold Board Review told us it's a part of the science and the philosophy. If you don't have it, that's like your heart, your mind, your body. All that stuff, it all has
3-part. Gotcha.
the 3 T's. Thoughts, traumas, and topics. Subluxation. What is subluxation? It is vertebral spiral complex or joint complex. So actually, it's not just VSC, it's actually joint as well. Integrity, yada, yada. Back to your question. What was your question?
Well, my main question was we were talking about integration with chiropractic.
Okay.
But I want to kind of go a little bit deeper on it. How would that look? How would that look?
That would look like peace in the Middle East. My husband's Israeli, he knows about peace in the Middle East. It doesn't happen.
That would look like peace. That was awesome. So what I'm just saying, like, so what I hear you saying, let's say they two did combine, and I'm hoping they do, because I can see how it would work great. Would you say that it would be, you see the chiropractor first within, say, the hospital, and then from there?
I see them in urban centers.
Okay.
I see chiropractors fighting. Why are they?
Yeah,
Why
that's
against each other. Let's not even talk about the medical doctor. Why are chiropractors fighting against each other? He said it, and he's not a chiropractor. He's a musician.
That's the same. I found it the same. The patients are their audience, and you are giving service, whether music or treatment. You have to see them. You have to see how they feel. And each audience, each kind of music, and each person, each client is just a different kind. You have to, if they like me, don't give them cheesecake.
I like him. Keeping it simple. I like that. The KISS method.
KISS method.
Yeah.
Classy, sound, kiss time.
Yes.
I love it. He's like, keep talking, honey.
So he's going to be our patient. Why? Because he's in a subluxated person. Where is your pain, sweetheart? Neck.
Okay.
They're up in his neck. Lay on the chiropractic, keep your glasses on. Have you had this done?
My back or?
Wherever, I don't care.
You are funny. Yeah, whatever. I don't care. Just get on there. I'll take care of you.
So would you like to see some chiropractic treatment of a mobile chiropractor? The only one that I know of here in Virginia, Fredericksburg, right? Wish it was in Virginia Beach, but you know, whatever.
All right, let's do this.
Fine. Okay. Yes, I'm wearing a skirt, but normally I don't wear a skirt. Right. Because I'm not that Jewish. Okay. So we have a right short leg. We have tightness in the calf, more on the left than the right. I'm going to ask him now. Is it painful here at the SI joint? Yes or no?
Yeah.
Is it painful here at the sacrum? Yes or no?
Yes, but less.
Yes, but less. Is it painful here?
No.
So the sacrum has twisted. Hold up. This is from chiropractors. This is next time. His name is Steve. And Sophia, if you're bitchy. Okay? So these are not together. So what he had, rub my name on it. Thank you, Dr. Mullen, Mopal class. Okay, so what he has currently is he has a right or left short leg, right. So we're looking at the body this way. This is the right, this is the left. Right side has gone posterior inferior. That raises the leg up. But his sacrum hurts, and it hurts more on the left. So it hurts less in the middle, not really on the right, but it hurts on the left, but he has a right short leg. So what is it? Is it AS or PI? Anterior superior or posterior inferior? He has a posterior inferior here, here on the left, and an AS on the right. So what do I address? I address where it hurts, but also here it hurts here in the middle. So this little guy, this doodad here, has gone cattywonk. This is what Sid Williams talk is. I'm not a Southerner. I don't know. All I know is fix the body. So I don't have a drop table. All I got is this 15-pound Lloyd portable table. And no way am I putting him on his side because he's 240 pounds. Sorry, sweetheart. I'm really good cook. He's gained 30 pounds since we moved to Virginia. Okay, so it hurts here, but it hurts here, but it hurts less over there, but he's right short leg. So what do? We go to the doctor's bag. I talk and I do treatment at the same time. Do you hear me, Beth, over there?
Hear you perfect. You're doing great.
So what's this called? The clicker, aka the activator. Activator 2. I don't follow the protocol. I follow my own diversified protocol BS.
The clicker.
So if it's short on the left or right, right side, but it hurts on the left, and the middle hurts too. Setting 4 in the middle. I'm activating or putting an impulse into the sacrum to tell it to move. Now I'm hitting that side joint between the sacrum and the ilium, the ischium. Ilium, not ischium. Ischium is on the butt. Do you have butt pain? Butt pain. Right there or right there? Coccyx is out too. So coccyx is a smaller one. So you go to a setting 2 so you don't blow out the coccyx. Now, why am I doing low back when he told me better without the back? Why am I going to low back when he told me his neck hurts? Because primary, secondary curves of the body. These are
Roots.
the roots. This is your foundation. If this is off, this is off. If that's off,
Right.
cervical and lumbar go together. Okay? I'm still on setting 2, but I'm in the lumbar now. So he says it hurts right here at L4, L5. See, I treat the body fully, not only going to the cervical. Okay? Paraspinal muscles on the right are jacked up, aka rock. This man loves to work outside, like a jerk. Here you go, look up. No, fight me, put down. Relax.
I love it. Don't fight me.
There, T2. Ready? Now, his head's not on right because that's why it's been a jerk lately. Here we go. Ready? Breathe. Put it down. T1's still a little tight. I don't have a drop table. What am I going to do? I got to make it work. Just like RuPaul says, flip it over. Yeah, like a pancake, flip over. How's it looking? Okay?
Perfect.
Right. Yeah, don't hold on to the table. Please. No, don't hold on to the table. Thanks. So I was taught my life, go to the side and laterally flex it, meaning go to the side and put it to the side. Drop your head, meaning relax, wiggle your toes. hard as a rock, but the impulse was there. So maybe I didn't hear it crack, but did it crack severe? It cracked, it's fine. But you're still in pain, right? Yeah, you are right now, relax. Still garbage. He's one of those little neck, big muscles.
Mm.
So what do? Do you fight it more? Do you fight the into, I don't know, slowly come up. Don't get, dizzy. Don't get dizzy. Well, let me help you up. Hold up.
That chiropractor is stronger than me. I've been lifting 50, 60 pounds on a daily basis. I don't know how. She is strong.
Look up. All the way. Sit right, please. Look up. Down. You see that?
Mm-hmm.
To the right.
Okay.
Look to the left. Ear to the shoulder. Ear to the shoulder. No, sweetheart. This way. This way. He has lateral flexion diminished. He still has upper tracts tight. Now, some chiropractors don't do myofascial release. That's their prerogative.
Right.
All this is like a rock. They can
So
have
how do we break that down then?
Now I'm beating him up more than most patients because I can. I have the right. Okay, so this is all a rock. Okay, he's not sitting up straight. You want to do the full Nelson?
Sure. Oh, yeah, I know.
Yeah, So because I'm 5'1" and he's 5'9", and most of my patients are taller than 5'1", I do the full Nelson, aka thoracic traction, not standing like John Zonfrio taught me. May he rest his soul because he was like 6'2". Okay, but I do it seated, hands behind your head. Please and thank you.
Oh yeah, that's a good one.
Turn his arms. Okay, now some do this weird thing. I can't do it. Some do whatever thing. I do this. If I can't get inside and go like this, and their patients don't like it, I do my best to wing it. Okay, and I put my back in. Bend over. How's the low back feel now? Better, believe it or not. A little bit does a lot.
So better believe it or not. I love it.
Good job.
Awesome. Wow, that was good.
Okay, so what's going to create integrative profession? People being sorry. Right? First of all?
Perfect.
Okay.
You're close to New York. You're supposed to do that.
A born and bred New Yorker. Okay. Then I moved to Westchester. Then I moved to Connecticut. Then I moved to Bronx. Then I went to East. Then I moved to Queens. Down here. I've been
Nice.
Yeah.
So let's talk a little bit about the concierge you do. I love that. When I looked at your website, I was like, wow, I love that. Talk to me. Let's talk about that.
Yeah, we'll talk about it. I mean, my website is wyx.com. Why I was there? That was my present when I graduated. I don't know about SEO. I don't know about marketing. I don't know about advertising. About money. Just down. But in Virginia, I had 0 clients.
Mm-hmm.
In Brooklyn, I charge $250. I maybe do full body. I only do 5 here. I can do arms and biomechanical construction. I had trouble for the clinic that brought me down here. Not my turn. My practice is concierge chiropractic LLC, New York, New Jersey, Virginia. Why? Because that's where my business is. Primarily Virginia, oh, that's where I live. I live in New York, concierge chiropractic, New York, PC. But I'm in New York right now. So obviously, New York City, the average rent is even hanging is $5,000.
Wow.
And chiropractic should be. 85 minimum, or 500 maximum. No insurance. All of his insurance care about chiropractic, and it doesn't care about the patient. Patients care about the patient. And that's not just me, folks. That's every single chiropractor. Most people take insurance, most chiropractors, and
Correct.
dental medical doctors just instead of now. Yes or no?
Yeah.
So I chose to be a mobile chiropractor so that I can do this in my living room. Or in your living room, aka you, the patient. I have adjusted on a surfboard. I have adjusted
Wow.
one horse and multiple dogs. When? I'm not saying, and I don't remember. The first was in Georgia with a animal chiropractor named Dr. Jacob Barron. Baby, just my own baby, still do. He's 9, little baby. I adjust the husband, I adjust the child, I adjust the niece and nephew, I adjust the brother-in-law, I adjust the brother, I adjust the mom in the wheelchair. And if my father was alive, I'd adjust him. He told me the father to become a chiropractor. I am doing under the life doctor. If you look at my bio, it says he was the only doctor was before on cardiac and complications, diabetes, and I know from that, and I know I should be. I may be fat, but I'm pretty. I'm pretty smart. So I can, but I can't stop ugly or mean.
Hmm.
Say whatever. I don't care. I care about one thing. Bringing hope to the hopeless because they've already tried the medical and the other chiros, and they said, "Holy crap!" And this is my last. And of course, there were a patient at the clinic I worked at on Saturday. She went through the list of chiropractors she saw in the local area. She said, "This is the one shot." What she got.
Wow.
To me in New York, and I showed them both bitches because I love them. What I got, the horse and the cop, which very tough with the take off the horseshoes.
Mhm.
I took one of these and I got a high five and a hug. I love my patients if they want me to hug. I cry with them if they want me to cry with them. I was send VITC veg. Like, so sometimes they need a,
We all do.
of course, and that's
Yeah.
why you like to do what you do with
Mhm.
stories. Okay.
Wow. I love it. Let me ask you another question is, how did this become your passion? How did you get into this field?
Okay, so I know the typical chiropractic story. When I was 5 years old, I was a chiropractic patient. My dad took me along. He used to teach at Gorman and Reggie Gold, up in New York and Stroudsburg, Pennsylvania. Reggie's dead. Sharon moved to Georgia. And every pill and potion, every MD, all the MD said you should have surgery. He said, if I have surgery, I'll die on the field. So Dad died when we got to high school. Said to me, be a chiropractor. I mean, chiropractor. I want to be my father.
Wow.
For what? So then he died. I'm 17 and a half because I graduated high school at 17 and a half. And I'm like, what do I want to do? Daddy, be chiro. And start doing the free science courses with this part. And then I took a course in television production. I really like movies. Really like television. Maybe I could teach. So I did in my 20s, I said, holy crap, I'm in my 20s, 2007, and I'm interviewing for not changing their life. Appreciate it. Look at that beautiful lower third that's going. That's an upper third now. That's a beautiful thing that you would turn on. Nobody cares, right? So I reevaluated to my ophthalmology. And I have my bachelor's in liberal studies with a concentration in communications. And what does that do for me, Jack? Unless I want to do television, which is so much kind of practice if you don't know what you do. Then I took a personality test. Then I went to nursing school. And I hated it. I love the patient interaction. I hate and blood and feet.
Mm.
So then I went again. And went back to that alumni, to the personality test. And it said chiropractor. It said nurse. Chiropractor, nurse, film. I was a television and film producer for many different networks. That was my 20s. My 30s was chiropractic school. I had my son November 22nd, 2012 on the light just by myself. 6 months x-rays. It didn't show up on x-rays. Radio, doctor of
Wow.
cardiology. Look at the x-rays. Said I was pregnant. Why? The kid came out in November. And those x-rays done in August. Anywho, whatever. I call him that every day. It's an answer as a 9-year-old. He's my miracle, he's my heart, he's my son, like Jacob. So he was born in apartment 102 at Life University Commons. In my bathtub, not the pool. He is a true chiropractic miracle. He got me.
Wow, that's awesome.
Yep. And so after that, I tried to do the baby as chiropractic,
Mhm.
31, even chiropractic school I mean with the kids, and it didn't work. So thank God for my sister and her husband who took on my son. Every weekend, every single person was, and every professor. Sorry, I'm flying home from Hartsfield Jackson. He started to recognize me. It's one of the largest airports. To Westchester County Airport or LaGuardia. Every other,
Wow.
I was a diamond medallion, and I didn't even use it for 6 months. The program told me. Why? Because I had a kid to go home. I took out grad hospitals and went to
Mhm.
mission trips. I didn't even. I did outreach at Life University, and then I worked at the Bronx, Brooklyn and Queens, the Harrison, in the ghetto. And people coming in with all problems. So that's my journey. Chiropractic chose me. I don't know why.
Wow. So right now, what would you say your goal is for the next, say 5 years in chiropractic, and like what your vision is?
How does this mobile thing really work? Because
Mhm.
I don't know why it's not. They want Uber Eats and DoorDash. Why don't they chiropractor come to their door like back in the day when it was what?
I like that.
No, but really, I can do everything that a clinic can do. I can make hot packs with the patient's towels, some water, and a microwave. I can do a 10th unit from Amazon for less than $20 if I need to. I can use massage tools or lotion, massage oil to myofascially fix right here. Right here, this is between radius and ulna, and in between you got the interactive membrane hurts. Everything with these and a table. And if I don't have a table, I got something on the bed.
Wow.
I've done it. I'm not old in that. I graduated in 20. I've worked my ass off since.
Mhm.
I know it's not going to take. I know that if I keep working hard, it'll kill me, or I'll kill it. One of the two.
I love your passion and in your a lot of fire in you. I love that. I don't see a lot of chiropractors have that, and I'm not bagging. I'm saying I can tell people can get tired and weary. And I think that you understand that consistency is the key. And you're very bright. So I believe that God's going to open up the doors for you on what you need to do next, because I can just.
So it takes to get a yes.
Hmm.
Chiropractic patient acquisition is like finding a husband.
Hey, that was awesome. And
getting the interview / dating stage / first adjustment stage. Because if you don't get them on the first adjustment and the morning after, then you don't get them at all. And I've been paying up to $300, lasting 45 minutes. Why? Because I listen to them, I talk to them, I adjust them, I educate them, I myofascially touch them, I do the joints, I even pet the dog and check that for someone's station. Now, should I touch the dog? Yeah, they're $20. But I gotta find out in Virginia how I practice I don't. I'm not gonna do anything. Fine.
oh wow. So I know that you do a little bit 50-50. You go to people's homes, and then you also work at an office in Virginia, correct?
And I work at a Virginia clinic here.
Okay.
One is a Saturday.
Mhm.
Monday, Tuesday at one clinic, Friday, Saturday, another clinic, and then complaints and then lunch off.
And then what's the best number for people to contact you if they want to do, say, mobile in your area?
Okay, so the area code is my cell phone.
Okay.
Okay, hold on. Let me turn it. 914
Mhm.
306 2. My website, www.drnadinw.com. drnadinw.com. That's the website. The email address is dr.davw@gmail.com.
Awesome. Great job. I'll make sure I have everything on the screen. And Dr. Nadine, I just want to say you are a pleasure. You're literally a pleasure. And go ahead.
Okay, I gotta make it 3 questions. 1, did you have fun? Because I crack jokes, crack backs, and crack necks. 2, did we answer your question of will we integrate chiropractic into that?
Yes, you did.
I did?
Yes, you did.
Piece in the middle. 3, have you ever had mobile chiropractor on your show?
I've never seen it where it's just like what you just did with your husband. That was beautiful. I mean, what more can I say? There's not even a 4.
Okay.
Okay.
For more.
Here, I'll come back for more. That was that was awesome. Well, thank you so much, Dr. Nadine, for being here on the show. You are awesome. And I will make sure that everyone has your cell phone on the screen. Make sure everyone, even people that are on my Facebook page and people that are looking for a good chiropractor.
I'm in New York, New Jersey, Virginia.
She's everywhere. Mobile.
On travel.
Wow. So you heard it there.
5. 75 for the initial, there's $10 extra to do the full history, 65 here in Virginia. New York depends on where I gotta travel. New Jersey depends on where I gotta travel.
Right. But the beautiful thing is people can get a hold of you, and of course you can arrange that and make things work.
If I could do telemedicine, aka chiropractic, I would. But I gotta touch you, don't I?
5 fingers.
Hey.
Exactly. I love it. Thank you so much. Magic hands, as they say. And
I've been called magic hands healing goddess, and I don't.
Oh well, I like healing hands or healing. I like healing goddess. Anyways, thank you so much for being here on the show, and keep us updated. I'm gonna want to know, because I know for a fact that mobile chiropractic is just the beginning.
Thank you so much, Mark. I really appreciate it.
Thank you so much. You're awesome. God bless you. And your husband in the background.